Daniel, it has been 6 years since we did our first Shine Chat in the Zahn Ballroom. Technology has changed. It was zirconia, multi-layer zirconia at that time. Now we are in an evolving industry where the focus really is on 3D printing. What do you see in the market? What are you most excited about in regards to 3D printing in dentistry?
Yeah. So first of all, thank you, Andrew, for having me here. It's really exciting the times that we're in dentistry, because it's truly as far as I'm concerned, it's the most exciting times that we're here. So technology is truly proliferating the way we do things in restorative dentistry, and it's moving at a fast pace that is incredible to where it brings us to today, which is 3D printing. Now, 3D printing allows the laboratory to really think outside the box, to be able to create restorations or products as well as solutions and services that can truly scale in a great way. But ultimately, it's not just the scalability of the laboratory space, but it's also the opportunity for us to elevate the standard of care. So these restorations that we're able to do now with 3D printing are significantly superior to what we did in analog. And now we're able to do that in a repeated and consistent basis while scaling it for the laboratory space.
In your opinion, how has 3D printing and the evolution of these materials changed a laboratory's workflow?
Well, it changed it in a major way, because now they're able to utilize, it's one of the things that I do in my lectures also that I speak about, is that we want, rather than us carrying the technology, we want the technology to carry us. And that's where it truly has gone to, and it's still evolving, if you will, because we're seeing still new innovations like polyjetting and obviously DLP, which we started with SLA. But the idea is that if the technology can carry us, the equipment is what really is doing the heavy lifting in these prosthetics, and that allows us to focus our dental intelligence to provide the best solution, and then have the equipment via 3D printing really elevate and increase the standard of care for the patients.
So you just mentioned polyjetting, and that is the buzz around this show this year. How do you envision a dental laboratory's workflow going from the two-piece printed denture to now a monolithic inkjet permanent denture solution? How will that change a lab's workflow and really result in maybe a more profitable opportunity for that business?
Absolutely. So that too is evolving, and it's a component of both the software and the hardware. So the software, there's a lot of development in the software that allows us to incorporate colors, incorporate different layers, and thereby the hardware then is able to do a monolithic denture, but where the gingiva or the denture base is going to be the pink color, and then as the tooth gravitates towards multi-layers. So the idea is back to your question with how is the laboratory benefiting from that, the less post-processing that they have to do to be able to provide the patient the best of the restorative solution is what is ideal, not only in composition for the denture, because it's no longer two pieces, even though the chemistry still allows it to almost be monolithic, but it's not true monolithic, where a polyjet truly is a monolithic, meaning that it builds from under all the way to the top, so it's a one piece, which makes it stronger and better and an elevated, again, standard of care protocol for the patient.
What I'm hearing is a lot less labor-intensive process for a laboratory.
Right. It's a lot less labor for the laboratory, because we're facing also in our profession, in the laboratory space, a shortage of talent. And the equipment is able to really be able to kind of leverage that so that there's less labor needed, or that dental intelligence is incorporated into the software so that you can then multiply and scale that dental intelligence. So even though there's less talent in the dental profession right now as far as the laboratory is concerned, but those that have that high dental intelligence can now scale and extrapolate and multiply their knowledge base and fundamentals of what is a viable dental prosthetic.
Do you think we're at the official tipping point of analog and digital meeting somewhere in the middle for these specifically removable workflows to help a laboratory be more efficient and effective?
So I think we're a little bit beyond the tipping scale already, where it's more leaning on towards the digital. The analog is where a lot of the fundamental and the dental intelligence comes in. So that's our seasoned denture technicians that are seasoning out, if you will, within the next 10 to 15 years. So it's our responsibility as those in that industry to be able to share it down to the next generation so that they can take that dental intelligence, which is the fundamentals, what is viable in the mouth, what is going to last in the mouth, rather than just creating a restoration, but then be able to do that and multiply that by, however much the software and the hardware allows us to.
So as the professor of restorative dentistry, what are you most excited about in the future for this industry?
So I'm actually really excited about many things. And as technology evolves and as we're seeing it in live, we know where things are going. So I'm excited about AI. I'm excited about the opportunity to really be able to utilize the software to its maximum capabilities. AI is certainly something that's very, it's something that's growing, which is a data aggregate of a lot of data assets. But if the learning component is where I think is most critical, because AI is only as a function of what it is that the learning component allows that. And that's where the dental intelligence really has to come in so that the AI can be even that much more powerful. But that's looking ahead in the future. The second thing in the laboratory is thinking outside the box. Now rather than talking about impressions and talking about gypsum products and metal, now we're talking about data sets.
Right.
So how do we maintain those data sets? How do we use those data sets? And how can we extrapolate? And I think the laboratory is in the greatest position because they receive so many data sets from all their clinical doctors. And what does that mean for AI? What does that mean for us as a learning profession, and the evolution of which is what yet to come? And that's what I'm excited about most.
Well, it's no secret that this industry continues to evolve. And we sat down 6 years ago to talk about zirconia and subtractive manufacturing. And now it's all about 3D printing in this industry. So appreciate your time and look forward to what comes next in this industry.
Absolutely. Thank you so much. And it's absolutely exciting times in our profession. So happy to be here. Thank you.